I am Jay Bogis, working with Times of India as a media professional, specialized in advertising and all. I was suffering from the last 10 years with sleep apnea, obstructive sleep apnea, and I fell asleep in the morning in the office also. Can you please explain? Yeah.
So he's been having trouble with sleeping for past 10 years. He's had a very disturbed sleep. He would joke up and wake up many times in the night. He almost started sleepwalking, and he's already developed things like diabetes or blood pressure. And it was really affecting his daily schedule. He could not concentrate. So we were looking for a solution for quite some time, and we had met various ENT doctors in the past who had given us some solution. We had even started using CPAP machine for his sleep, and it helped to some extent, but that was not the solution for the problem. So finally we met Dr. Vikas, and he's undergone a surgery. His sinus was removed, his rhinoplasty was done, and he was removed. A lot of procedures which were done, and finally he's
Nose and throat surgery.
Yes, nose and throat surgery. So now he's able to breathe much better. He's able to sleep better,
Yes.
and we can see his concentration level has gone up. He's able to work more efficiently, and we are really happy with what has been.
And you've lost how many kgs?
6 kilos now.
Okay.
Yes.
How about your diabetes and blood pressure?
It's under control.
They
It's
are
under
in
control.
check.
Yes.
We are we are taking medicines alternate.
I am taking alternative days
Every
the
day.
medicine. I used to take every day, but I am taking an alternative.
Okay. And how about the choking which used to happen?
The choking episodes have really gone down now. When he's lying sideways, he doesn't choke. Of course, when he's lying on his back, he does choke a bit, but that's been definitely reduced. The snoring sound has reduced, and he's sleeping much better as compared to what he was sleeping earlier.
And you still have to lose 10-15 more kgs.
Yes. I'm
Remember?
trying for that after
Yes.
that time.
Yes.
After that it will be.
I'll go for the dietitian and
Yeah. After that it will be almost complete.
Sure. Thank you.
Really happy. Thank you. Thank you so
Thank you,
much.
doctor. Thank you so much for